Hello and welcome. Today we're going to take a closer look at something you use every single second of the day, probably without even thinking about it. Yep, we're talking about your arm. It is an incredible piece of natural engineering, and we're about to find out just how brilliantly designed it really is. So let's just start with a simple question. Have you ever really, truly stopped to think about what makes your arm so useful? I mean, from throwing a ball, to typing an email, to giving someone a hug, it's involved in just about everything we do. To figure that out, well, we've got to look under the skin.
You know, when you really get down to it, the arm is this amazing system of bones, muscles, and a whole network of nerves. Those nerves are kind of like the electrical wiring that sends messages from your brain. So to really understand it all, let's take a little guided tour, starting right where it connects to your body and working our way down.
Okay, our first stop is the shoulder. You can think of this as the base of operations for your entire arm. It's what gives you that all-access pass to the world around you.
So the shoulder joint is, and this is no exaggeration, the most mobile joint in your entire body. It can move in pretty much any direction, which is exactly why you can reach up high, get something from behind your back, and move all around.
Now, here's where it gets really interesting. There's a trade-off. To get that incredible range of motion, the shoulder has to give up some stability. Think of it like this. The more a joint can move around, the less stable it is. And that's exactly why it's so much easier to dislocate a shoulder than, say, your knee. It's a classic case of mobility versus stability.
So what's actually holding your arm onto your body? Well, that's the job of something called the shoulder girdle. As you can see, it's really made of two main bones: the clavicle, which you know is your collarbone, and the scapula, which is your shoulder blade. This whole framework is the anchor for every single move your arm makes.
Okay, let's move on down from the shoulder and into the upper arm. I like to think of this area as power central.
This part of your arm has one single, very strong bone at its core, the humerus. It's the longest and biggest bone in your whole arm, running all the way from your shoulder down to your elbow. It provides the main structure that all the muscles pull on to create movement.
The muscles here are organized into two really simple groups. You've got the muscles on the front, the anterior group, and their job is to bend your elbow. Then you have the ones on the back, the posterior group, and they do the opposite. They straighten it out. And each group is controlled by its own special nerve, acting like a wire that carries the move command from your brain.
This just shows you how different nerves are, like dedicated switches for different actions. One nerve fires up to power your shoulder. Another one tells your triceps on the back of your arm to straighten out. And a completely different nerve signals your bicep on the front to bend your elbow. It's just a beautifully organized system.
All right, continuing our tour, we now arrive at the forearm. And this section, well, it has a very special and very clever trick up its sleeve.
And that trick is the ability to rotate. These movements are called pronation and supination, and they are absolutely essential for our survival. I mean, think about it. These are the motions you use to pick up food and bring it to your mouth. So simple, but so important.
Here's a really easy way to remember the difference. For supination, think soup. You turn your palm up as if you're holding a bowl of soup. You're getting something. For pronation, you turn your palm down like you're giving something away. Getting and giving, it's that simple.
Of course, with such a complex and hard-working structure, things can sometimes go wrong. So let's take a quick look at a couple of common issues. First up is something called student's elbow. This happens when a small, fluid-filled sac right on the tip of your elbow gets irritated and swells up. This little cushion is called a bursa, and just like the name suggests, it often happens from leaning on your elbows for too long while you're studying or at a desk.
Next is golfer's elbow. This is a pain you feel on the inside of the elbow, and it's caused by repetitive strain on those muscles you use to bend your wrist and grip things tightly. And despite the name, you definitely don't have to be a golfer to get it.
And here's a little practical medical fact for you. Knowing where all these nerves are is absolutely crucial. For example, when a nurse gives an injection into the deltoid, that's the big shoulder muscle, it has to be in just the right spot. Otherwise, they risk hitting that important nerve that controls the whole muscle.
Okay, we have covered a lot of ground on our tour. So let's do a quick recap of the arm's basic blueprint, just to put it all together.
So the key things to remember are, the shoulder gives us incredible mobility. The upper arm, built around that big humerus bone, provides the power. The forearm gives us those clever twisting movements, and tying it all together is that amazing network of nerves, the communication system that makes everything happen. And to finish up, I just want to share a really lovely thought that connects this anatomy to a bigger human idea. Pronation is giving and supination is getting. There is no less joy in giving than in getting.
And that brings our tour to a close. So now that you have a better idea of the incredible design behind every single movement, here's a final thought for you. What's the most amazing thing your arm helps you do?